What an honor and privilege to be here today at this grand opening. Howie, thank you so much. Tom, thank you. Thanks for your leadership. First of all, thank you to SaVida for choosing to come to this region. The need is absolutely here. Issues with opioid and alcohol abuse, we know, permeate our communities. Making sure that we have outpatient treatment centers like SaVida, I think, are going to be critical for us to address that. You know, we understand much more today about addictions than we have in the past. We understand that they are indeed not just an issue of somebody that is viewed maybe by others as not being able to control their personal behavior. This is truly a biochemical reaction that happens in the brain. So we understand that. We understand the things that need to be done. We understand the clinical treatments that can go into getting people past the addiction, keeping them on the road to recovery. And we understand, too, it's critical to get them to re-enter society. We want them back in our communities. We need them there. So this is part of the pathway to make sure they get the treatment here, they can re-enter, we find a place for them to be employed. All those elements are critical for successfully recovering and staying in that recovery mode throughout a lifetime. So I want to thank you so much for what SaVida does here in the community. These are the critical elements of what it takes to have a community-based program, and we all know how important the elements of public health are with this, and making sure that we have a comprehensive, integrated approach, not only taking care of things clinically, but also making sure that the other elements of what happens in the county here, from the health department to social services to law enforcement. You see all those different partners here today, which tells me that they see the importance of the services that SaVida provides. And as you said, residential treatment holds a place, but outpatient holds another place. And outpatient is the way for us to make sure we integrate patients that suffer from this back into society. We want to make sure that they become active and contributing members to our society. Nobody wants them there, I would say, at mercy of this unfortunate cycle of abuse. We want them back as healthy members of society. So I want to thank SaVida for your efforts here and for coming to Prince William County. I think this is a great example about what can happen back and forth between clinical programs, reentry programs in the community, and things that we have to continue to do. This opioid abuse epidemic, and that's exactly what it is, continues to stress communities. Now, the good news is that if you look at the numbers, they have, I think, plateaued. But the key is where do we go from here? It's great that we've stemmed the increase, but we want to make sure those folks that suffer from that have a path to success to make sure they get their lives back in order. That's where SaVida comes in. So again, Howie and Tom and Andy, thank you all so much for your efforts to be here in Prince William County. I think this holds great potential and will stand as an example for other counties and the things they need to do to an integrated approach to recovering from opioid abuse and alcohol abuse. Thank you. Thanks again. Thanks, Andy. Thank you.
Thank you.